Hello, everyone, and welcome back to Beyond the Pain, Heart and Home Healing After Loss. So today I'm doing something a little different with my format. Normally I'm a planner, I'm a write everything down kind of person. So normally I have some sort of like script or bullet points or just very in-depth, detailed descriptions of what I'm going to talk about. And even though, yes, I do have a topic and I do have like a couple of notes, I am going to do this episode without a script or without any sort of like really detailed notes. So I kind of want to give it a try. I'm going to see how it goes. I might love it. I might hate it. I just really want these episodes I want them to be informative, yes, and helpful. But I also want them to be personal. I want you guys to see me, who I am, and my scripts are who I am. But I just kind of want to give this a try. Okay, so we're going to give it a try and see how it goes. Okay, so today's episode is all about being an advocate for your own health or somebody else's health. I put a poll out there on my social media and basically asked, like, I gave a couple of options, and honestly, it was split 50-50, and this was one of the things that I had posted about, and honestly, I was surprised that so many people were interested in me talking about, being either a health advocate or a caregiver to somebody. So obviously, as you know, my husband has Crohn's disease and colitis, and we've been through a very, very, very long journey of a lot of up and downs through his health. And before I say anything else, I have to give this disclaimer. I am obviously not a medical professional, okay? I am not a doctor. I am not a nurse. I'm literally not a professional in the medical field whatsoever. So don't take this as medical advice and just take this as my advice from somebody who has a lot of personal experience in this world of advocating for somebody and honestly being a caregiver. Like I would consider myself my husband's caregiver when he's not doing well. So I'm not a professional. You can't come back at me and say, your advice didn't work, or I'm just giving you my personal experience, okay? And I do have a lot of it. So, okay, so let's just talk about how we got here. So my husband has had Crohn's disease for many, many years. He had emergency surgery, back in 2013, I think. But he's kind of had a very manageable case ever since then. He's had to go back into the hospital for a couple of like flare-ups, they call them. They threw him on a steroid and sent him on his way. He would stay on that for 8 weeks, and then he would go back to normal life. So for most of our marriage and our relationship, like we really didn't have to think about it because he would just live life normally. We'd go to the hospital every, handful of years. They'd put him on a steroid and he would be fine. And so it wasn't until after our daughter Layla had passed that when he went into so she passed in November of 2022. That following summer, it was June or July of 2023, he had one of those like episodes, we'll call it, where he went back into the hospital for a flare up, and they put him on a steroid, and that's when they started saying, well, that's not when they started saying, but really all the advice that they gave us was, you need to start taking a biologic. And that's what they've been saying for years, but he wasn't, showing any like crazy signs or symptoms that he needed one other than, a hospital visit every handful of years. And it just seemed like, why would he take this like crazy medication if he didn't really have any crazy symptoms? Nobody really educated us on why it was important. They just told us you have to take this biologic, basically. And at that visit, after Layla had passed, they also diagnosed him with colitis. That was the first time they ever diagnosed him with colitis, which means the disease basically had moved into his colon, not only in his small intestine. And so we were like, but again, they gave him a steroid. He went home and he was fine. So we were like, okay, like, you're fine. Now, long story short, looking back, I'm pretty confident that a lot of the reason that Rick's disease got as bad as it did was because of unresolved grief, unresolved emotions, just harboring lots of feelings. At one point he had a health coach, which we hope to get him back, linked back up with. He's just very expensive. Basically, he told us the story about this one kid who was so sick. It was like the sickest patient they had ever had of either Crohn's or colitis. I can't remember. And he was so sick and nothing they were doing was working. until he started working on his mental and emotional being, and then he started seeing results and his health started to, progress and all those things. And so that's a very short version of that story. But my point is like, after Rick realized, once we put our finger on the fact that we thought that the main issue was that unresolved grief and everything, that's when we started to see real health and true growth in his overall health. But anyways, so they sent him home with the steroids, and it was fine. They sent him on his way. And as the year went on, we came up on Layla's like 1 year death anniversary and all those things and all of those memories and like reliving, and all these things were getting like, just brushed up. And even I was struggling. I had my own health issues. I was in and out of every single doctor's office. And I won't get into my story right now, but we both were having health issues. And then my husband's health like just plummeted. Like in like a 3-month span, he lost like 40 to 50 pounds. He was barely eating. I literally could barely get him to eat. Then just slowly he was like looking yellow and just rail thin and was sleeping all the time. And literally remember being like, just being so, I would weep with joy when he would like wake up for a nap. Like, and the crazy thing was I didn't even know what was wrong. Like, yes, I knew he had Crohn's and colitis, but like there was no like emergency. Like we didn't have to take him into the emergency. And that's our only experience with his disease was like, oh, it hurts. Like take me into, into the emergency room. And so that's what our experience was. But with this, it was like, I don't know what's wrong with you, And so again, I won't get into like the details, but basically there was one day where I was just like, something is wrong. Like my gut was like, something is wrong. You have to take him in. We did. This was in January of 2024. Yes. So we took him in, and to be honest, all I remember them telling us at that visit again was like, take this biologic. No education, no anything else. I think they may have given him some antibiotics for like an infection or something like that, but it was very much like, at the time, I just remember I was coming out of like a fight or flight. So I was just trying to like, I was taking things one day at a time. Like if I was getting by each day, like that was a win. And so my mind wasn't in the right place to like, to demand answers from these doctors. It was just basically like, is he okay? Oh, okay, he's okay. All right, we'll just go home then. We decided to look into the biologics because we were like, well, maybe it is what you need, And those details don't really matter. But I remember after that January visit and talking to a GI specialist who actually educated us on what the biologic does and why it's helpful and why if you don't take it now, this is why things are going to get bad. We decided to give it a try. And the only difference there was the education behind it. And the only difference there was somebody like sat down with us and really took the time to teach us and show us why it is so important. And she wasn't a holistic doctor, so she didn't, I don't want to say she didn't care, but she wasn't taking the grief and the emotional and the mental, toll on Rick. She wasn't taking that into account. She's a doctor. She prescribes medicine. That's what she knows how to do. And so that's what she did. So now fast forward 2 months later, Rick had taken his first dose, and we landed back in the hospital in the ER when one night his pain was, it like improved a little bit because I think on January they put him on a steroid, but that quickly like wore off because he was in such rough condition already. And so we were back in the emergency room with the worst pain he's ever had. And it was coming like every 15 minutes. And I was like, we have to go. And so from that moment on is where I will never forget. We were in the emergency room, and I personally had just come out of feeling like I was living in fight or flight from, the grief and the trauma of, the birth and all of that. I was finally coming out of fight or flight. I had gone to grief counseling. And so I was learning how to process my emotions and my feelings and all of those things. I had finally taken hold of my health, and we ended up back in the ER, and I finally felt like I could think straight. I finally felt like, okay, I can't just leave this up to chance anymore. I can't just leave this up to whatever the doctors are telling me that day. Not to discredit their knowledge, but I have to take control over what the heck is going on with my husband, because I don't want to come back here anymore. Like, why do we keep ending up back, in the hospital? And so I remember that one night thinking like, oh, and I had finally had like a little bit of a breakthrough spiritually. I had ignored God for over a year at that point, and I had been through all the ups and downs with him and all of that. And so I remember that one night that we went back in March. I believe it was March 15th. I was sobbing in the ER, and he was, passed out. They had given him some pain meds, so he finally was able to rest after being up for several hours that night. And I was sobbing in the ER, and I just prayed over that room that we were in. And I just remember that was like me going, I am going to figure this out. And I will never forget that moment, because I was exhausted. I had just pulled myself out of a hole. So, meaning that's why I was so exhausted. But I decided that I am not going to leave my husband's health up to chance anymore. I am going to figure out what is wrong and what we need to do moving forward to give him and I the healthiest, best life possible. I'll never forget that night. And I believe some of that also came out of a little bit of like a fear of guilt, because rewind to when Layla had passed, there were not a lot of signs. I won't get into this, but I'll just briefly mention, like, there weren't a lot of signs that something was wrong with Layla. Actually, I had a very, very healthy pregnancy. And I think the week before she passed, I had a doctor's appointment. And according to the doctor, everything checked out. Like, everything was fine. And so there were no signs that I was like ignoring or anything like that. There was like a little bit of like slowed movement, like towards the end. But I truly believe in my gut there was nothing that I could have done differently to prevent it, other than being educated on slower movement, which they don't educate you on for first-time pregnancies, which is such a shame, because you don't know anything. You don't know what anything's supposed to feel like. This is your first baby. So there's where I think the disservice is to first-time moms. But other than educating me from the very start, I really genuinely in my gut don't think there's anything I could have done to prevent her death. But I think that role of needing to make sure I had my hand in everything as far as my health is concerned came from a little bit of a fear of missing something. I said it to my dad so many times when I was in the hospital with Rick, like, I feel like I'm missing something. And a lot of that was just trauma speaking. And a little bit later on, I'll talk about like knowing the difference of when it's your turn to step up and when it's time to kind of like step back and let the doctors do what they're going to do. But that's a lot of where my passion came from also. And I think that's one of the reasons why I felt so passionate about stepping up and taking control of my husband's health. Because another thing that I learned is, being in the hospital so much. I think we counted the other day. Geez, what did we count? We counted like 15 hospital stays or something like that altogether. I believe it was something like that. And so we have a lot of experience in the hospital, in the emergency room, on the actual floor, dealing with nurses and the staff and surgeons and all of these things. He's had multiple surgeries at this point. And one of the biggest lessons that I learned was the difference between what the hospital's job is and what my job is. And this took a lot of learning and educating. Okay, at first I took control of my no, that's a bad way of saying it. I stepped in and decided I'm going to figure this out. But I was an anxious wreck at the beginning. I did not step in and do this flawlessly from the beginning. Like, I had a lot of anxious phone calls with my dad and, just like I said, constantly saying like, I feel like I'm missing something. And you have to understand the difference between I'll use the word hospital because that's my experience, but I'm talking to hospital, medical professionals, like anybody in the medical professional world, versus what my job as the health advocate is. And the hospital is, their job is to keep the patient alive. They don't know the patient's story. They don't know their life, their day in, their day out. They don't know anything about. They might have good bedside manner, but their patients are patient number, fill in the blank. And that's like, they churn these people out. And it's the same in doctor's office. Like, it is one after another after another. They learn things in school when they got their degree. When this happens, this is, what the issue is, or this is what the issue could be. Like, it's not personal to the person that you love that you're advocating for. But that's where your job comes in, and because you do have a personal relationship with that person. And that's the difference. The hospital, the medical professional, is there on a very objective basis to make sure that this person stays alive and that things are functioning. But you are the person who knows them the best, knows their schedule, knows when they take their medicine and their supplements and all of those things, what affects them and how and why and all the things. Like, that's what I said to Rick all of the time. Because I think people in hospitals and medical, in doctor's offices and whatever, I think they're so used to dealing with people that are just like, okay, sure. Yeah, I'll take that medicine, or sure, I'll do that. And they don't ask questions. And that's where I think that people really get it wrong with their health, is because I said this to Rick every single time. Anytime I had to step out of the room or I couldn't be there, anytime, which wasn't a lot, but anytime I had to leave and I wasn't able to be present. 2 questions. What is that? And why are you doing it? Or, when they would go to put something in his IV, what is that? And why are you giving it to me? I have said this so many times, and I love my husband, but he is a terrible advocate for himself. And I'm not bashing the hospital. They're not doing anything wrong. They're actually doing exactly what they should be doing. And they took very good care of Rick objectively. They objectively took very good care of Rick. But if I didn't ask, what is that? Why is that? What's the point? When's the next dose? Like, all of these things, like this, the hospitals, the doctor's office, they're run by humans, human beings who make lots of mistakes and don't know your loved one like you do. And so I just literally, I don't care how annoying I was. After I built up the courage and I realized how serious of a situation it was, when my husband's life was on the line, like, there was nothing that was going to get, I was not okay, sure, you can do that. Sure, give him that. It was what, why, when, how. Like, give me all the information, because I don't want to have to look back and go, I should have asked this. I should have done this. And that's not to like create fear around it. It's to encourage somebody that being a good advocate is worth the energy. It's worth the time and sometimes the sleepless nights of being that caregiver for that person that you love very, very much. Another way I can phrase it is, the hospital did their part. They were responsible for doing their part. But I had to take responsibility for what my part was, which was Rick's overall, his complete oversight of his health and his care. You know how people say to moms who are dealing with their children, like, mom knows best. Like, if a doctor gives certain advice about their child and it's not working or whatever, and it's like, you know your child best. That is the same for most likely whoever you're taking care of. Like, I know my husband better than every single one of you in this room. I might not know the way the human body works like you do, but I know my husband. And so together, your knowledge of how things work and my knowledge of my husband, we're going to come up with a plan that works. And we're going to come up with a whatever it is. You see what I'm saying? Like, it's a delicate balance. You can't, that's a thing I had to figure out was, I couldn't necessarily let the responsibility or the weight of my husband's health weigh me down, because I did do that. I allowed it. I took too much responsibility. Like if he lived or died, it was going to be my fault. That you can't do that. You have to find the sweet spot in the middle. You can't just be a yes man and just say yes to whatever the medical professional is telling you without doing any of your own research and things like that. But you also have to trust the people who know and are educated when it comes to life or death situations. Do you know what I'm saying? And that's the situation we were very close to being in. So I had to find that sweet spot, somewhere in the middle. And another example I can think of, which is very close to home, is so there is a organization called Crohn's and Colitis Lifestyle, and that is where my husband found his health coach. If you were a part of the story of my husband's health early on, one of my really, really good friends actually raised a lot of money so that we could afford this program, because it's very expensive. And so anyways, the owner, and I believe the CEO of this company, his story was even worse than Rick's. He was literally dying. And the doctors couldn't figure out why they couldn't get his disease like under control. This was back in, I want to say, like 2014 or something like that. He was dying on his deathbed. He couldn't figure out like why he was like nothing was working for him. And it wasn't until he decided, he uses this phrase all the time. It wasn't until I decided to become the CEO of my health until I started seeing improvements. And again, that's not to create fear that the medical world doesn't know what they're doing. They know they're educated people, but at the end of the day, nobody knows us or our loved ones as best as we do. And at the end of the day, it's our health is our responsibility. And yes, we can only do so much, and genetics play a factor. Yes, but at the end of the day, I don't want to get into that side of things, but maybe at another day, as to where, disease, originates from and all those things. I would love to have that conversation, but I'm not ready. I'm not prepared for that today. But at the end of the day, like, it is our responsibility. It's not the doctor's responsibility to heal us. It's their job to see us when we come in and go, we have a problem, but it's not their responsibility to heal us. If that means anything to you, because, and I love that story about Dane, how he said, like, I had to become the CEO of my health. And that is what ultimately, between him taking ownership and a little bit of the doctors, navigating him through medications or whatever, and, just getting super knowledgeable on supplements and lifestyle, all those things, he literally built an entire company on it. And he's helping lots and lots of people like my husband who are now suffering. Like, that all came from that one decision where he was like, I'm going to become the CEO of my health. And that is crazy. And, there's lots of different situations, and I don't want to paint this picture as like, oh, in every single situation, like, because I know, like, yes, our situation was serious, but I know nothing about the world of, cancer. Let's use that for an example. So I can't speak to every single situation. Okay. I can only speak from my personal experience, mine and my husband's experience. But this is my personal experience, and part of my experience is me deciding, like, it's worth it for me to give up some of my, normal life. Like, I don't have a full-time job right now for a couple reasons, but one of them is because I've decided to prioritize my family's well-being, and specifically my husband's health. Like, at times it can feel like a part-time to full-time job, and I'm not complaining. This is the choice that we've made. And I feel like a lot of people will say, well, I can't give up a job. I won't be able to pay the bills or, nobody who's going to take care of the kids and whatever. And to that, I would say, like, yes, like, in some circumstances, like, you have to do what you have to do. But as far as money is concerned, like, no money problem is as big as someone's life being on the line. Like, it's just not. Like, when Rick was in the hospital for a couple months and neither of us were working, it's like, who cares if the bills go unpaid for a little while if my husband doesn't make it out of here? You know what I'm saying? Like, it's health over everything. And when you have health issues, when they get bad, it forces you into perspective. Like, you have no choice but to literally now have perspective. And so before it gets to that point, like, I guess my PSA of this episode is, like, being a health advocate, a caregiver, like, and I know those are two different things. Like, they're not necessarily always the same, but they can overlap. It's worth it. Like, it's you're being, I'll use the term the health advocate one, because that's the one that I feel like I really am, wanting to speak about here. Is it's worth it. Like, who cares about all the other things you have to give up if this person isn't healthy and thriving in your life? You know what I'm saying? And so it's a choice. You have to choose to prioritize it. And you can't not prioritize something and then be angry with the results or the lack thereof. Like, you just can't. And that's what I learned, is we let the issue go for so long. We didn't prioritize it. And then I guess kind of got angry, and it's like, wait, we can't get angry. We didn't do anything about this. So instead of dwelling on being angry at this being our situation, what can we do about it? And that's what I decided that day in the hospital. I was like, what am I going to do about this? I'm going to take ownership of it, and we're never going to be back to this, terrible spot. And I know some things are out of our control, and I'm not saying that, every little thing is under our control. I'm a walking testimony that not everything is under our control. And even when you have a perfectly healthy pregnancy, like, something can still go wrong. I understand that. But the things that we do have control, it is our responsibility. It is hard to prioritize. You have to give a lot of things up. If this is your situation, money, time, energy, like, all of these things, like, yes, you do have to give some up, some of these things up, but there is that balance. And this is something I learned much later, on down the road of my health advocate experience, if you will, is I have to take care of myself in the process. As the person who is giving the care and being the health advocate, like, if I don't sleep for days and I eat like crap for days and I don't move my body for days, like, I'm no good to my husband or anybody else who's taking care of my husband. Because if I can't think straight, what good am I as an advocate or a caregiver, And so that is also very, very, very important, is to take care of yourself. And it doesn't even need to be a lot. You don't have to go over and above and, get to the gym. As a matter of fact, during these stressful times, I would recommend not doing crazy exercises at the gym, because you're just, sending your body into more, stress, into a more stressed state. Like, it's not about being fit in that moment. It's just about taking care of your mental and emotional and a little bit of your physical health so that you can focus on what you need to do. And so a couple of the biggest takeaways that I just kind of want to wrap things up with is, you do have to take care of yourself through these things. If you're going through something where you have long days, nights at the hospital, if it's, similar situations to what we were going through, like, you are no good to anybody if you are not taking care of yourself. And that is a lesson I learned the very, very hard way. I remember when we were at our hospital stay, like the really long one that we had last year in March, April of 2024, I remember I was so sleep deprived. And my dad was trying to ask me questions, and Rick was on the bed next to me, and he was not doing well. This was after his surgery. And I knew in my gut that something was like wrong, like his pain was like still off the charts. We're talking like almost a week post surgery. His pain was still off the charts. And, he would have a conversation with the doctor when he walked in and say, he would kind of say, like, I just got to like tough it out. And then they would walk out. Same thing with my dad or anybody that would come to visit. And he would be writhing in pain. And I'm like, this isn't right. Something is not right. And I remember just like weeping because I felt like nobody was listening to me. But instead of being able to articulate what I was trying to say, I was so freaking sleep deprived. My dad was like, you need to go to sleep. He was absolutely right. So I stopped sleeping in the chair next to Rick. And because I wasn't doing anything productive just by sleeping there. The first couple nights after surgery, I was helping him with, whatever he needed help with, because he literally couldn't move. But after that, I was just being anxious for no reason. There's nothing I can do sitting here, especially because he was at a point where his vitals were stable and things like that. It's you have to figure out, when do I need to be here, and when is like I need to go take care of myself so I can be here when I need to be here. That's another thing that I had to learn the hard way, and a huge takeaway from this, this whole conversation. Another thing is, you have to be vigilant. It is your responsibility. to, care for the ones that you love. Yes. And of course, I guess I want to do a little disclaimer and say, like, adults have choices. If you have a spouse or a brother, or, a sibling or a parent who is just being, who's just being really stubborn about their health, and they're not like in critical condition, they're just not taking care of themselves, then you can't take the responsibility for that. When I say you have to take responsibility for the people that you love, I mean if they're in really, really rough condition. My husband was like, he couldn't think for himself. Most days he couldn't stay awake long enough. He was so tired. And then at the hospital, he was literally drugged up 99% of the time. Those are the situations where I'm like, if they can't think for themselves, that's when it's your responsibility and to be vigilant and step up and say, how are we going to fix this? If you just have stubborn adults in your life, well, adults make their own choices. And if those are the choices they're going to make, that's not your responsibility. And so that's my point, is you have to be vigilant. You can't fall asleep at the wheel and be a yes man to medical professionals. But at the end of the day, you have to learn how to release control when you don't have any. And like I said, it's about finding that balance between taking on the responsibility, like if this doesn't work, it's all my fault. That's got to stop, because it's not true. But also being in a vigilant state and knowing that if you're just a yes man and you just go along with anything that anybody ever says, that, you're not educating yourself as much as you possibly can. I remember in those early days of sitting in the hospital, I took out my husband's notes, and well, they were my notes, but his classes and his courses from that program that my friend raised money for. I was watching those videos. My husband was laying in bed, couldn't think straight for himself. So if I just relied on, a lot of what was going on with the doctors, like, I don't think we would be where we are at now. Like, it was that knowledge and that time that I was diligent, that I poured into learning, like, what our next steps are going to be, that I really feel like have gotten us to where we are today. It is a complete team effort. It is the medical professionals' responsibility objectively to take care of the patients that walk in the door. But it is ultimately your responsibility to become the CEO of your own health or somebody else's health who may not be able to do it for themselves. And the last biggest piece of advice as a health advocate or caregiver that I can give is speak up and ask questions. Like, you are not being annoying. And even if you are, like, I don't care. My person, my loved one, for me, it was my husband's well-being is on the line. And if you don't like that I ask questions, like, I'll go find somebody else, who doesn't care that I have questions, and just being unashamed about the fact that you care about your health and that you want to do the best that you can do for the person that you're caring for and that you're advocating for. It is so important. You will not regret being a good advocate for that person. And all of these months later, all of these hospital visits later, I can very confidently say that the care that we have gotten was worth every sleepless night and worth every sacrifice I've had to make to be able to care for my husband the way that I have. And it's getting me emotional because, my husband was really, really close to losing his life. With all the infections that he was dealing with and, the weight loss, and he was so close to losing his life. And I truly believe it was a team effort, between the hospital and the doctors that we were dealing with, and my diligence that had gotten us to a point of Rick being able to thrive again. And he did just have his reversal surgery, and his recovery taking a lot longer than we thought, for sure. He's still in a much better place than he was the first time he had to have, the last time he had to have surgery, I should say. So he's lost weight again. It's not as easy to eat, but we're hoping and praying that those are just, healing from, surgery, recovery, and it's easy to get trapped in the spiral of anxiety. And that's maybe the next episode that I want to, talk about is the anxiety of all of that all of this can bring. And so I think that's all I have for you guys today. Thank you for letting me kind of talk off script. I hope this was still super informative and helpful. Be sure to subscribe to my channel to be alerted for any new episodes. And of course, a positive review is always really helpful and much appreciated. I can't wait to talk to you guys again really soon. Signing off for now, your Hope Dealer, Emmy Smails.